Hi, my name is Alexandria Bope, and today I'm going to talk to you about an article called Animal Assisted Therapy for Patients with Disorders of Consciousness Following a Traumatic Injury. This was published in the American Journal of Occupational Therapy in 2022. So this was a full systematic review, and the question was, what is the evidence for the effectiveness of interventions to improve arousal and awareness for people in a disordered state of consciousness post-TBI? The main theme of the article included the systematic review brief is animal-assisted therapy. So here's a clinical scenario. More patients are surviving TBI, traumatic brain injury, because of improvements in early resuscitation, interventions, and rehabilitation. So increased survival is evident for patients with disorders of consciousness following a severe TBI. Disorders of consciousness include comatose, vegetative state / unresponsive wakefulness syndrome, and minimally conscious state. Neurobehavioral function outcome measures may include items that capture whether a patient has emerged from the minimally conscious state, but recent practice guidelines recommend practitioners use standardized neurobehavioral assessments to measure improved diagnostic accuracy for disordered states of consciousness. This will also help identify trends in the patient's recovery trajectory and the effectiveness of rehabilitation care. Evidence demonstrates that patients can experience meaningful functional recovery 5 to 10 year post-injury. We provide the current evidence about interventions that can be provided by OT practitioners as a part of treatment plans for adults with disorders of consciousness. And this systematic review brief focuses on animal-assisted therapy interventions. So the summary of the key findings is kind of in this table that we're going to look at. One study that used animal-assisted therapy intervention met the criteria for the inclusion in this systematic review. And the levels of evidence are in the table. Let's look at the table right over here. So this is a 1 level 2B RCT study with moderate risk of bias, used AAT as part of the plan of care for individuals in a disordered state of consciousness. There's a low strength of evidence that supports this intervention. So the setting was rehabilitation, and the country was Switzerland. The population was 17 to 72-year-olds in a minimally conscious state following an acquired brain injury. So this could be traumatic or non-traumatic. The intervention was standardized therapy sessions that integrated an animal that matched patients' preferences and abilities. So dogs, guinea pigs, and rabbits were used. Activities followed the Affolter concept and included brushing a dog, cutting vegetables, and feeding the guinea pigs or rabbits, or opening a box of herbs and feeding them to the rabbits or guinea pigs. Control period included standardized therapy sessions without an animal. The delivery method was individually in a rehab center. So the dose was 15-minute sessions and then 4 sessions a week for 4 weeks. So this was either 2 times a week or 8 sessions with an animal, and 2 times a week or 8 sessions without an animal. So the results, there's a significantly higher rate of eye movements and amount of phonation during animal-assisted therapy were observed during video recordings compared to other control therapy sessions. Behavioral reactions such as perception, information processing, and nonverbal communications per the Balser vegetative state assessment were rated significantly higher during the animal-assisted therapy compared with the control. So what does this mean for us and for me in future practice? I think that it's great to look at the research, and it seems like this was a statistically significant article and intervention. So someday when I'm working with brain injury patients, it's good to know that this information is out there. Thank you.